Hi, my name is Dr. Corey Gray, and I am an Environmental Program Coordinator here at the Arkansas Department of Environmental Quality. As you know, part of our mission here at ADEQ is to protect Arkansas residents from potential sources of harm in the environment. Today, I want to bring your attention to a topic of concern here in one of our Arkansas communities. A neighborhood in Crossett, located in Ashley County in the southeast corner of the state, has reported a suspected cancer cluster. Given the location of the nearby Georgia Pacific Crossett Paper Operations Plant, a facility which produces plywood, paper, and formaldehyde resin, we feel a full investigation is warranted. It is suspected the disposal of the company's waste into air and local waterways may be contributing to the reported spike in cancer cases nearby. For the first step of our investigation, it will be crucial for our team of epidemiologists to confirm the community's suspicion of a cancer cluster. In order to formulate a plan to do so, we have been working closely with lead epidemiologist Dr. Ashley Snow, the director of the Hazardous Waste Division of ADEQ. Dr. Snow emphasized the importance of a swift decision by administrators to empower the team to undertake the study so that action can be taken if the community's suspicions are correct. She stated, Ashley County, and Crossett in particular, features a population that is financially disadvantaged and medically underserved. Our immediate involvement in the suspected cancer cluster is critical to protecting the health and safety of these at-risk Arkansas residents. According to the U.S. Census Bureau, Crossett has a population of 5,128 individuals, 22.8% of whom live in poverty and 27% of whom work for the Georgia Pacific Crossett Paper Operations Plant. Ashley County residents also have higher than average rates of disabled young adults and uninsured families. As such, these residents make up a particularly vulnerable population, and it is our responsibility here at ADEQ to take action to protect them. Crossett residents have been reporting suspicious cases of cancer to the United States Environmental Protection Agency and local health agencies for decades, only to have their claims tossed aside. As you can see from this graph, Ashley County's overall cancer rates are not excessive and are, in fact, well below those found in other areas of the state, particularly central Arkansas. However, it is important to understand that below average incidence rate in the county as a whole does not necessarily preclude the possibility of more localized clusters in neighborhoods downstream of the paper plant's waste disposal. For example, residents report that of 15 households neighboring the facility's wastewater disposal stream, 11 residents have died of cancer over the last 2 years. If shown to be true, this would be a significant deviation from typical cancer rates in the area and would indeed confirm the existence of a cluster. If a cancer cluster is confirmed, then a study must be undertaken to assess the risk factors in the local environment. Residents and physicians in the Crossett community have reported their concerns to both the Arkansas Department of Health and us here at ADEQ, and their cooperation in confirming a cancer cluster will be key. To begin the process, our team of epidemiologists, led by Dr. Snow, will reach out to community members in the affected area using a survey that will be mailed out to every area resident. This survey will allow potential cases to be identified. Phone calls and in-person visits can then be used to complete the data collection process. Once potential cases are identified, health records from the affected individuals must be obtained. This will allow investigators to analyze the data regarding the types of cancers involved, the affected individuals, and the time period over which the cancers developed and were diagnosed. The findings can then be reviewed against records in the State Cancer Registry and census data to evaluate the concern. As previously mentioned, Crossett is home to a large wood processing facility. The plant, which was originally known as the Crossett Lumber Company, has been in operation since 1899. It has grown significantly since then, especially after the site was purchased by Georgia Pacific in 1962. The sprawling plant now covers roughly 1.5 square miles of property, where it operates 24 hours a day, 7 days a week, 365 days a year, and it's less than a mile from town. Processing facilities such as the Georgia Pacific plant are widely known to produce large quantities of highly toxic byproducts, and this plant in Crossett is no exception. According to the U.S. EPA's Toxic Release Inventory, by the plant's own admission, it produces more than 1.5 million pounds of hazardous chemical waste each year. Byproducts of the production process include known carcinogens, such as dioxin, formaldehyde, chloroform, and acetaldehyde. The Georgia Pacific plant disposes of these hazardous materials by dumping them into nearby Coffee Creek, a tributary of the Washita River. The aerial photo you see here speaks volumes, but residents say the pictures do not do Coffee Creek justice. Although some reddish-brown discoloration is natural downstream of any wastewater treatment plant due to the biological compounds produced, these would not explain why residents now refer to the body of water formerly known as Coffee Creek as Stink Creek. This nickname comes from the acrid, foul-smelling fog that wafts off the creek into nearby neighborhoods, especially on hot days. This fog, which stings their eyes and burns in their airways, is likely the result of hydrogen sulfide contamination, another known byproduct of the plant. Although hydrogen sulfide is not a carcinogen in and of itself, high levels can contribute to other health issues. According to the Centers for Disease Control and Prevention, chronic exposure to the toxic gas can cause weight loss, inflammation, chronic cough, neurologic symptoms, and muscle weakness. The net strain on the system can contribute to resident susceptibility to other diseases, such as the cancer cases that have been claiming the lives of Crossett residents for decades. Addressing these concerns is more complicated than it sounds. The plant claims to be in compliance with state law. It currently holds a valid ADEQ permit to use Coffee Creek, also known as Stink Creek, for waste disposal. However, it is this agency's opinion that further testing should be done by an independent laboratory to evaluate potential contributions of the wastewater disposal area to the drinking water of affected area residents, especially in light of the plant's recent citations for being in violation of the EPA's Clean Air Act with regard to its high levels of hydrogen sulfide contamination. Soil and air quality samples should be taken near the plant, in the vicinity of identified cases, and from a set of controls in nearby areas. Given that residents also report increased incidence of cancers in workers at the facility, samples should be taken at work sites and employee homes as well. Biological monitoring has always been an essential part of tracking risk in cases of occupational exposure to carcinogens. For this reason, biological monitoring for both the waste products of the plant themselves and for the metabolic byproducts of the chemicals in the body should be undertaken. According to a recent study in the British Medical Journal, The data points which must be followed in the case of chemicals released from paper plants such as that of Georgia Pacific are clear. It will be essential to conduct monitoring of the biological markers of exposure and effect. Blood testing for elevated formaldehyde human serum albumin conjugate and reverse transcriptase polymerase chain reaction testing for analysis to changes in chromosomal RNA will be key targets for biological monitoring. Our epidemiologists recommend 2 separate studies to assess the risk. First, a retrospective cohort study of current and former employees to further confirm outcomes potentially caused by exposure to the specific byproducts of the Georgia Pacific plant should be undertaken. This type of study is cost-effective and data efficient and a great way to ascertain the potential scope of the risk. A case control study of affected area residents should simultaneously be undertaken. Given the long latency period of most cancer diagnoses, it will be important to identify and correct the source of the exposure as soon as possible so that area residents can be informed of their potential risk. Early biological monitoring and intervention for those exposed to these hazardous byproducts will be key to mitigating the potential damage. As part of the case control study, blood samples should be taken from each participant to test for levels of substances of concern. These levels can then be cross-matched with the environmental testing results of local soil, water, and air samples to identify the risk of bioaccumulation and potential sources of contamination. This knowledge will be instrumental in creating a plan for the Georgia Pacific plant to mitigate the damage to already affected residents and employees and to prevent further harm to the community. It is important to note that our agency may face resistance to this investigation. The Georgia Pacific plant is owned by the billionaire Koch brothers, who have a deep bench of legal talent at their disposal. They may file lawsuits against ADEQ or the Arkansas Department of Health, or they may offer settlements to affected residents in an attempt to prevent disruption in their supply chain. Additionally, the plant is Ashley County's largest employer. More than 1 in 4 residents report to work for Georgia Pacific every day. These individuals depend on the facility, toxic waste and all, to put food on the table for their families. The community simply cannot afford the economic impact of losing the plant as a source of jobs for local residents. As such, it should be emphasized by all parties involved throughout this process that the goal of this investigation is not to shut down the Georgia Pacific plant, but to protect area residents and ensure the facility's long-term sustainability. Although we here at ADEQ understand and respect the financial concerns of area residents, health effects of this magnitude simply cannot be ignored. With paper plants similar to the one in Crossett scattered across the nation, producing more than 9 million tons of carcinogenic waste every year, the implications are simply too great to ignore. If the cancer cluster is confirmed and found to be a result of byproducts from the plant, Georgia Pacific and other companies in the industry must find more responsible ways to dispose of the massive amount of hazardous waste produced not only at this facility in Crossett, but at others like it around the state, the country, and the world. Given the limited financial means of the residents of Ashley County and their lack of access to health care as an underserved rural area, our agency's involvement is absolutely necessary to carry out our stated mission of protecting Arkansas residents from environmental hazards. More information about the issues addressed in this presentation is available by visiting the following sources. Thank you for your time, and I look forward to working together to ensure generations of healthy residents in Crossett and around the state through our efforts here at ADEQ.